This is Learning Module 2, first short video. The object of this video is to define some terms from the last unit. The first term we're going to go over is the definition of disease. It's how the disease is defined, any harmful deviation that's not normal from normal body function, generally associated with some signs and symptoms that can be measured. The next one is the disease classification. There are a couple different classifications of disease, such as acute, subacute, and chronic. Acute would be a short disease that happens once every so often. Subacute is somewhere in between acute and chronic. Chronic would be ongoing disease, such as cirrhosis of the liver. That can also be acute as well, but chronic is something that isn't going away. So the next one is etiology, the cause of the particular disease, what leads up to the disease itself. An example of this one would be not masking. While talking to a COVID patient, that would be the etiology of the disease would be you didn't mask while you were talking to someone who was positive with COVID. Our next definition would be pathogenesis, and this is the explanation of how the disease will progress from start to finish. A common cold will start with the feeling of sickness and then having symptoms, but will ultimately end up with you being back to normal within a couple days. From there, we have symptoms. This is a subjective complaint, so something such as labored breathing would be a subjective complaint. You feel like it's hard to breathe, so that is considered a symptom. In contrast, a sign is a measurable or objective manifestation. So a fever of 102, that's considered a sign because it's measurable. It's something that is not, we know the normal temperature that someone should be, and it shouldn't be 102, it should be somewhere around 98.6. Now, syndrome is a compilation of these signs and symptoms. So the measurable high blood pressure and headaches will lead to a syndrome, which will be hypertension. Diagnosis, that is the natural cause the nature of the cause. So after looking at the signs and symptoms, you can come to a conclusion of what is wrong with the person. I personally had appendicitis, and they did a physical exam where I showed rebound tenderness in the lower right quadrant, and then they also did lipase to rule out any pancreatic fatigue or anything like that. So they saw my white count was super high, and they saw that I had rebound tenderness in the lower right quadrant, which led to a diagnosis of acute appendicitis. The next one would be complications, possible adverse extensions of the disease. So this would be something unforeseen, like cancer treatment not working. This can also affect the prognosis, which is our next one. But if you are receiving cancer treatment and the cancer is not shrinking, then that can be a complication of the cancer. Prognosis is the probable outcome of the disease, so what is to come and how the disease will progress. They have a good prognosis of cancers. A lot of them, you can judge how long someone will be with that cancer and or how long they have to live. And then diagnostic tests, we talked about them with some of the diagnosis, or with the definition of diagnosis. That one would be the rebound tenderness of appendicitis. That is a diagnostic test, as well as some laboratory tests like the complete blood count. That is a test that will confirm there is a need for antibiotics, or if it's viral, obviously not antibiotics. It also confirmed diabetes. Diabetes is easily confirmed by a high A1C and a high fasting glucose. So those are the definitions that we had to define.